The BPBIO 320S has 5 different printing options as shown. The full BPBIO 320S result sheet shows you 6 outputs and the pulse graph. The outputs included are systolic blood pressure, diastolic blood pressure, mean arterial pressure, or MAP, pulse pressure, or PP, pulse rate, and rate pressure product, or RPP. If you've ever had your blood pressure taken at the doctor's office, the measurement is expressed in 2 numbers, with systolic measurement on top and diastolic measurement on the bottom. Similarly, you will find these 2 numbers as the first 2 readings labeled systolic and diastolic on the BPBIO 320S result sheet printout. Systolic pressure is the pressure of blood exerted on the artery walls when the heart contracts and pushes out blood. Diastolic pressure is the pressure exerted on the artery walls when the heart relaxes and expands with blood. The optimal range for systolic pressure is between 90 to 120 millimeters of mercury. Systolic pressure above 130, known as isolated systolic hypertension, increases the risk of diseases associated with hypertension, such as coronary heart disease, stroke, kidney failure, etc. Systolic pressure below 90 may cause inadequate blood flow to the heart, brain, and other vital organs. It may cause symptoms of dizziness, blurred vision, fainting, and nausea. Generally, low systolic pressure without symptoms is not considered serious. The optimal range for diastolic pressure is between 60 to 80 millimeters of mercury. Diastolic pressure above 80, known as isolated diastolic hypertension, is typically caused by arterial stiffness and may increase risk for cardiovascular disease. General ways to lower your diastolic pressure is to focus on heart-healthy foods, limit saturated and trans fat, and reduce sodium intake. Diastolic pressure below 60 may cause similar symptoms and issues as low systolic pressure, like dizziness, blurred vision, fainting, and nausea. Mean arterial pressure, or MAP, is the average pressure in the arteries during a single cardiac cycle. It is used to evaluate overall blood flow to indicate the delivery of oxygen and nutrients to the body. Normal MAP is between 70 to 100 millimeters of mercury. MAP above 100 is often caused by arterial blockage or stiffness and can cause excess stress on the heart due to elevated pressures. Over time, this can cause advanced heart disease, blood clots, strokes, heart attack, and an enlarged heart. MAP below 70 can be caused by insufficient blood volume, sepsis, stroke, hemorrhaging, or trauma. At least 60 is vital to provide enough blood flow to coronary arteries, kidneys, and the brain. Pulse pressure is the difference between systolic and diastolic pressure. This number represents the force that the heart generates each time it contracts. Normal range is 40 to 60 millimeters of mercury. Pulse pressure can be used to determine risk for cardiovascular disease, especially in populations over 60 years old. Pulse pressure below or above the normal range can be indicative of risk for cardiac events. Pulse pressure above 60 is typically caused by arterial stiffness, and pulse pressure below 40 is usually a sign of poor heart function. Pulse rate is the number of heartbeats per minute. A low resting heart rate can imply efficient heart function and cardiovascular fitness. The normal range is between 60 to 100 beats per minute. Pulse over 100 is a condition known as tachycardia, which can inhibit the heart from filling fully and cause inadequate blood flow and increased risk for cardiovascular disease. Pulse under 60 is a condition known as bradycardia, which can cause insufficient blood flow to the brain, chest pain, fainting, and heart failure. Athletes can have a low BPM, which may be a sign of efficiency. Rate pressure product, or RPP, is the measure of myocardial oxygen demand, which is the oxygen flow to the heart muscle. Health professionals use RPP to determine the efficiency of stress response under stressed conditions, otherwise known as a CPET or stress test. Some people may be naturally high or low. Therefore, we are more interested in any progressive increase or loss in RPP as a risk factor over a single measure. An RPP greater than 10,000 may indicate cardiovascular risk. RPP less than 7,000 may indicate that the cardiovascular system is too weak to increase heart rate or blood pressure to meet oxygen demand. Pulse graph is a visual representation of estimated arterial stiffness. The larger the difference in the lines represents a more elastic artery, while smaller differences may mean that the artery is less flexible. Stiffness in the arteries can be associated with increased risk, such as stroke, cardiovascular disease, etc. Arteries generally stiffen as a consequence of aging, but this process can be worsened by negative lifestyle habits and behaviors. Arterial stiffness increases risk for hypertension, coronary heart disease, stroke, heart failure, and atrial fibrillation. Finally, the test history includes results from the last 5 tests for systolic, diastolic, and pulse pressure. Keeping a record of readings taken over time helps monitor blood pressure and ensure that treatments to manage blood pressure are working.